Let me jump in to some of the questions that we're getting. Number one, for people who have had, I'm going to start with Fiona's question first, and it's linked to Honor's question. Dr. Constantinescu, if you have had a blood clot previously, is getting the AstraZeneca vaccine a more dangerous option? And similarly, Honor says many people are on a routine blood thinner as a result of past experience. Should they refrain from the AstraZeneca vaccine?
Yeah, so again, this is a very logical question. You know, it's great that people are asking these questions. The only factors that have risk factors that have been identified that might predispose people to having this rare blood clot from the AstraZeneca vaccine are being younger, so being under the age of 50, maybe a little bit of a predisposition to women, but that's not clarified yet, and being within 4 to 20 days from the vaccine. Any other risk factors, a lot of researchers and scientists are looking at, but have not identified a common thread in other types of risk factors. The mechanism by which this vaccine potentially causes this blood clot is very different. It's an immune-based mechanism, very different than how people get clots from other underlying conditions. The mechanism tends to be that you have an antibody that gets built against a protein on one of your clotting cells called the platelets. Then it activates the platelets, so you get more clot while using them up, so you get low platelets, which is a pretty rare phenomenon overall and very different than other underlying causes for clots. The question people have to ask themselves, if they do have a previous history of clot, whether they've had a heart attack or a stroke or other conditions, is the risk of having COVID disease itself, because that's the big threat, because we know that that can be much higher rates of clot from COVID disease itself than from the vaccine, which is why we urge people, even those who've had a history of this in the past, not to wait.
That is a point you have made before, and it bears repeating that one of the effects of COVID-19, it does cause blood clots at a much higher rate than any of these extremely rare cases we've seen associated with vaccines, either the J&J vaccine in the United States or the one case here in Canada. And there have been cases globally, but the risk far surpassed by actually having COVID-19 itself. A couple of other questions. You mentioned under 50. Sue was wondering, as a woman under the age of 30, concerned about future fertility being affected by potential vaccine side effects.
Yeah, so this question was also brought up, and this is a question that was brought up even with the other vaccines, like the mRNA vaccines. Initially, it was thought that was possible some biological plausibility that the vaccine, that the spike protein may look like one of the proteins on the placenta, so could it cause infertility that way? This has not been shown to be true in the studies. It hasn't been shown to be true in the actual real world data that we're seeing from now over 800 million vaccines having been given worldwide. And if anything, now we have more data that pregnant women, we have over 70,000 pregnant women in the US who have received this vaccine, over 4,000 successful pregnancies completed. We know it doesn't seem to cause problems with miscarriage or early demise of the fetus, which would tie into this whole idea of infertility. So we don't see any such effect having been shown in any of the trials or in the real world data with hundreds of millions of doses.
Okay, thank you for the answer. And Sue, thank you for the question. Here's one from Chris, who says, Chris had Chris's first vaccine, first AstraZeneca shot, about a month ago. How long after were the blood clots found in these reported cases?
Yeah, so Chris, good for you for getting vaccinated. And the it's about 4 to 20 days after. In the Johnson & Johnson, it seems that all of them happen within 16 days. So reasonably fast within, the 2 to 3 week mark after the vaccine, nothing seen past that.
Okay. So this is an interesting thing that you and I were talking about off camera, because I too had my AstraZeneca vaccine about 10 days ago. I had my shot. So since that time, obviously, I'm watching all the news, and I've been starting to carry in my purse low-dose aspirin, clot buster if anything should happen. And you were not laughing at me, but telling me that I'm not alone in doing this. Is this anything that anybody needs to be worried about, to carry prophylactically?
I'm so glad you brought that question up, because I've heard that question from many people. And I actually had one of my hematology friends, I called her up and she weighed in on this, because I wanted to make sure that we've thought of all the different possibilities here. So I can see why people want to do it. They want to do something. I get that. We don't think that, first of all, before any of this can happen, there doesn't seem that any blood thinner is going to make a difference, because again, the mechanism is an immune-based mechanism. So it's this building of antibodies against your clotting cells. And as a matter of fact, if everybody who had the AstraZeneca vaccine ended up having aspirin or a blood thinner, then the adverse events from having aspirin would be like bleeding, would be much higher than the occurrences from these rare blood clots. Once the process of this clot has started and is in action, the best thing to do is to get medical attention so that you can get treatment. And the treatment is actually an antibody to the antibody. So the treatment is there to stop the process from happening and to try to stabilize that clot with some blood thinners.
Okay. What do you watch for then? Don't worry about. Okay, obviously I'm doing the wrong thing, and you've made it abundantly clear. I was doing that to satisfy a concerned mother. But anyway, apart from that fact, what do we watch for then, Dr. Cora, in that time frame? Any symptomology that might have us going to the doctor?
Yeah, concerned mothers are important, so I'm glad you're addressing that too. But so feeling unwell past that initial 1 to 2 days after the vaccine. So they've started noticing people having symptoms and persisting past those day 4 and over. So feeling unwell, chills, fevers, especially if you have very worrisome, if you develop headaches, abdominal pain, or a rash around the vaccine, swelling in the limbs, chest pain, all these things, people need to get urgent medical attention.
Okay, I think we have time for one more, and I want to say thank you to everybody who submitted such excellent questions, and we'll certainly be having you back. Carla's question is specific for the growing number of long haulers, someone who had COVID-19 earlier, going back to February of last year. Is there a specific vaccine that a long hauler should take? And again, secondarily to that, is the AstraZeneca vaccine safe for a long hauler?
So there are some polls that have been done in the US after people with long COVID or long haulers had actually had the vaccine. Now, I don't know exactly which vaccines. I'm assuming these were mostly mRNA vaccines at the time that the polls were done. But here's what's really fascinating. Or more than 40% of people who had long COVID symptoms improved, their symptoms improved after having the vaccine, questioning whether the vaccine can be used as treatment. So it's a very fascinating finding, and more studies are going into this. But if anything, it seems that getting vaccinated, if you've had long COVID, might actually really improve those symptoms. So much so that people have some experts are calling on prioritizing that group for vaccination.
Dr. Cora Constantinescu, thank you for answering our questions. And thank you for coming back. Good thing we can finish our conversation. We'll see you next week. Join us, and thank you for the questions as always. We appreciate as you send them in to us.